Hi, my name is Jessica with One Love Doula Services. Today we are going to talk about 3 patterned breaths that benefit your pregnancy and your labor. These breath exercises will help bring more oxygen to your uterus and your baby, will help reduce prenatal anxiety, and help regulate your nervous system both during pregnancy and childbirth for a smoother labor experience. The first breath we're going to talk about is the diaphragm breath. With the diaphragm breath, we are going to breathe in through the nose and out through the mouth like we're blowing out a candle. So it looks like this. We'll also bring our hands to our rib cage to help us feel the expansion of our lungs and abdomen on the inhale and the contraction of that area on the exhale. I'll show you one breath and then we'll practice a few together. Inhale nose. Exhale mouth. Notice as I inhale, my hands come apart on the expansion, and as I exhale, my hands come back in toward my midline as I gently contract through my abdomen. Let's do that a few times together. If you would like, you can close your eyes to bring your awareness inward, or you can keep your gaze very soft. Ready? Inhale nose. Exhale mouth. Inhale nose. Exhale mouth. Inhale nose. Exhale mouth. 2 more breaths. Inhale nose. Exhale mouth. Very good. So you can do that for about 2 to 3 minutes during pregnancy to help calm your nervous system and reduce anxiety. And you can do that during childbirth, both during contractions or in between contractions. So let's go on over to the next breath. The second breath we're going to talk about is the ocean wave breath. This breath technique is similar to the yogic breath technique called Ujjayi, which breathes solely in and out of the nose, keeping the lips gently closed. On the inhale, we expand through the lungs and abdomen, and on the exhale, we slightly constrict the back of our throat to produce the sound of an ocean wave. It sounds like this. By constricting the back of our throat like that, we help to stimulate the vagus nerve, which innervates the back of the throat. When we do this, it sends a relaxation response to our brain, bringing us peace and calming feelings and relaxation. Let's do a few rounds of this together. Resting your hands comfortably in your lap, closing your eyes if you would like, or just softening your gaze. Inhale nose. Very good. You can do this breath anywhere at any time anytime you're feeling a little increased stress or tension, and you can access this breath during labor, during contractions, or in between. The third breath we're going to do is called the Bumblebee Breath, and it's called this because we look kind of like a bumblebee and we sound kind of like a bumblebee when we do this breath. We're going to use our hands and place our fingers over our eyes. We're going to take our thumbs and gently close the tragus or the flap of the ear. We're not pressing hard, we're just closing that enough to close off the ear opening. So it looks like this. Thumbs over the tragus or that ear flap, fingers over the eyes like so. We're going to inhale through the nose, and as we exhale, we're going to make a bzzz sound with our mouth. So let's do a few rounds of this together. Inhale nose. Inhale nose. Last one. Very good. This breath is particularly helpful if you get the labor shakes during labor or just after childbirth. It helps to stimulate that vagus nerve we talked about in the last breath technique to calm your body's physiological response to the hormones and the adrenaline of birth. Thanks so much for joining me. My name is Jessica with One Love Doula Services. I hope you enjoyed these breath practices.